Face-to-face encounter documentation, one of the top denial reasons for medical home health review today. Stay tuned for more information on how you can ensure your face-to-face documentation meets the standard. What is face-to-face encounter documentation? Face-to-face encounter documentation has been required since April of 2011 to ensure that your patients have seen a physician or non-physician practitioner for an actual face-to-face assessment. That documentation must be present in the chart prior to billing your final claims. Key details of the face-to-face encounter include that the patient was seen by the practitioner that is documenting the encounter. There must be documentation to support that they had a head-to-toe assessment, where documentation will include patient demographics that are specific to the patient with vital signs, etc., documentation of the diagnoses that the physician has identified as being current to the patient, treatment to any of those diagnoses, assessment, etc., including changes in medications, in any treatments, and any ongoing plans for the patient that should be a result of their being seen during this encounter. There must be documentation to support homebound status and medical necessity. If there is not enough documentation to support homebound status and medical necessity, the home health agency, following a comprehensive assessment of the patient, is allowed to document a clinical narrative supporting homebound status and clinical need that the certifying physician will then sign off on, those together confirming homebound status and medical necessity. The encounter must have a date where the patient was seen that was within 90 days prior to the start of care in home health or within 30 days after. The practitioner must document their clinical findings during this encounter, sign and date the document, and credentials for that practitioner must be evident. Telehealth requirements for the face-to-face encounter in home health began with the public health emergency when 1135 waivers granted home health agencies the right to conduct the face-to-face encounter via telehealth. Also at the same time, there was relief from HIPAA-compliant telehealth systems being utilized to conduct these face-to-face encounters. As you all know, the public health emergency ended May 11th of 2023, and with the end of the public health emergency, telehealth was actually extended through December of 2024 for home health face-to-face encounters. In addition, the extension of the non-HIPAA compliant telehealth systems was also provided through August 9th. So effective August 10th of 2023, all telehealth systems utilized for face-to-face encounters in home health and any other telehealth services must be HIPAA compliant. If the face-to-face encounter is conducted via telehealth, there must be documentation in the physician encounter note that the service was provided via a telehealth system that was both audio and video. One of the specific details which actually results in the number one reason why a face-to-face encounter is denied in medical review includes that the primary diagnosis for home health was not treated during the face-to-face encounter. The primary diagnosis on the start of care plan of care must be documented in the face-to-face encounter as an active diagnosis for the patient, of course, and there must be documentation to support that the physician assessed and treated, changed medications for, etc., that diagnosis. In order for you to get through medical review, even for subsequent home health episodes, that start of care, plan of care, primary diagnosis must have been treated, addressed, etc. during that a face-to-face encounter. The certification for home health is not complete until that criteria has been met. It is very, very important that your coders have access to the face-to-face encounter when coding that start of care plan of care to ensure that this element of the face-to-face encounter requirement is met. Please visit your Medicare MAC's website, Palmetto GBA, CGS, or NGS, to obtain additional information about face-to-face requirements and their treatment in medical review. Healthcare Provider Solutions stands ready to assist in any way that you might need. Face-to-face encounter at the top of medical review can be a situation dealt with in a positive manner. We are ready to assist you in any way necessary to help make that come to fruition.